Dr. Mathew Devine, the medical director at Highland Family Medicine, is back with us. Good morning, doctor.
Good morning, Mark. How are you?
Good. Let's dive right in on this. What's the latest on the orange zone restrictions here in New York and specifically our area?
Yeah, great question. So obviously currently the orange zone has been set up by our New York State leadership. And essentially from a medical standpoint, that has one major reason, and that's to help kind of stem or stunt the growth of COVID-19 cases. So obviously that continues as the cases continue to increase, but that does have ramifications, as we know, on other local businesses and students and others. And that's why we really work closely with our community partners and leadership to help try to bridge that gap so that we can, one, kind of stunt the growth, but two, not have everything completely shut down entirely.
Yeah, difficult balancing act to say the least. What has been the impact on local hospitals?
That's another great question. The hospitals themselves have a lot since the beginning of the pandemic. So, as time has gone on, they've been able to learn about how to make sure that they have enough beds available as to how the cases increase. What is recently occurred is the hospital beds are almost double where they were at their peak at the end of May. And so at this point, they may need to stop doing some of those non-emergent procedures to help kind of make sure that they prioritize and have beds for those that have severe COVID.
How about patient care in the outpatient setting? How has that changed, say, since the springtime?
Right. So what's important to remember, Mark, is we've been open all along. We've had to alter the ways that we're open, meaning if we're in person versus using some of those features like this, like televideo or telephone. I think what essentially happened was there are people that got lost to care or their care lapsed because they were understandably afraid to come into offices. But essentially, we are here for a patient, whether they have COVID or not. They should still reach out to their primary care doctors and others.
All right, doctor, our getaway question from your medical perspective, was this surge expected?
In short answer, yes. Obviously, we don't want to continue to see it go higher. That's the real question is when is it going to kind of peak and kind of go downwards again? And we're still looking at those numbers. Essentially, each and every one of us in the community has a job. In order to try to keep this down, we all have to do the same similar things together. And I think that that's the ongoing challenge, is that we sometimes forget that our individual perspective or what we do in the community can affect the community at large. I think having asymptomatic testing now at different sites is going to very much help, because there are those that are out there that have no idea that they even have COVID. And if we can find at least one or two of them, that's going to help significantly decrease us as well.
All right, we'll leave it there. Doctor, as always, thank you for your insight.
Thank you for having me.
If you missed any of our conversation, we'll share it online as well at rochesterfirst.com.